Narcan saves lives. Why Narcan trainings are essential for helping professionals working in rural Western North Carolina. So before diving into Narcan and how it can save lives, I first want to talk about opioids, because we kind of need to know what those are before we can dive into Narcan. So what are opioids? In our brain and bodies, we have opioid receptors, and opioids come from poppy plants and are turned into different substances. They are originally used to help manage pain and are often prescribed in medicines like hydrocodone, oxycodone, morphine, and yes, fentanyl. When taken, opioids bind with opioid receptors and send messages throughout the body that aid in lowering pain levels. Other opioids involve common street-bought drugs like heroin and fentanyl. Challenges with buying these substances is knowing what is in it and how much to use. Even though opioids can be highly addictive, not everyone who uses opioids has an addiction or an opioid use disorder. However, whether a person has a substance use disorder or engages in recreational substance use involving or excluding opioids, people are still at risk for opioid drug poisoning. You might be thinking, wait, how? Well, fentanyl, originally a medical painkiller, now has been manufactured and distributed outside of pharmacies and is often mixed with other opioid and non-opioid substances. Fentanyl can be upwards of 50 times as potent as heroin and 100 times as potent as morphine. So what happens when fentanyl gets mixed in opioid and non-opioid substances is that it increases a person's chance of experiencing a drug poisoning, also formerly known as overdoses. In the United States, 2/3 of drug poisoning-related deaths involved opioids. Opioid drug poisonings are among the leading causes of preventable deaths in the United States. Drug poisoning has a higher mortality rate in rural Appalachia than in other regions of the United States. According to the Western North Carolina Healthy Impact Community Health Survey, 46.5% of Americans living in Western North Carolina reported that substance use has negatively impacted their lives in some way, either through personal use or someone else's. So why Appalachia? Well, there are numerous different risk factors, like the region's higher unemployment and poverty rates, difficulty accessing qualified healthcare professionals due to transportation and/or distance, or a limited number of workers in the field. Additionally, the cost of clinical treatment and the lack of sufficient healthcare insurance to cover it is also prevalent in this area. Luckily, we have harm reduction. Harm reduction is a public health, social justice movement that aims to reduce negative or dangerous social and physical consequences of engaging in risky behaviors. These behaviors might be legal, illegal, or both. However, the goal is to reduce the chance of harm occurring to the person, not necessarily reducing the behavior. Wait, why? Well, abstinence from any substance is not possible for everyone and shouldn't have to be for folks to receive compassionate care. Instead, using a lens of harm reduction allows for a person's rights and safety to be the focus. It's important to understand that people use substances for all sorts of reasons, and not everyone who uses a substance develops an addiction or a use disorder. With this in mind, helping professionals should remember that addiction is often associated with trauma and other social determinants of health, such as poverty, lack of support, and difficult physical health conditions. Overcoming addiction is no small feat, but there are therapeutic interventions that can help folks who are struggling along the way. There are many tools and educational resources that can make using substances safer and can increase individuals' likelihood to access treatment. Examples of tools and educational resources that can make substances safer involve providing fentanyl test strips that can identify fentanyl mixed with other substances like meth, heroin, cocaine, or cannabis. Syringe exchange programs, which collect needles and supply new sterile supplies for folks who inject opioids or other substances. Education on safe use practices, like not using alone or using sterile supplies, which can prevent drug poisoning. And lastly, providing folks with Narcan and training on how to use it can help reverse the deadly effects of opioid drug poisoning. All right, let's talk about naloxone, or as you probably know it as, Narcan. Naloxone, or the brand name Narcan, is an opioid antagonist. That means it binds to the brain's opioid receptors and reverses/blocks the impact of other opioids. If someone is experiencing opioid drug poisoning, Narcan temporarily reverses the drug poisoning. This can buy the person life-saving time until more advanced medical support can get involved. Naloxone, or Narcan, comes in the form of a nasal spray or an intramuscular injection. It's simple to administer and can be safely given to most people, including pregnant people or babies. In North Carolina, people who give naloxone are protected by law. Naloxone access law protects you from legal action if in good faith you administer naloxone to someone you suspect is experiencing drug poisoning. The Good Samaritan law protects those who ask for help from 911, the police, or emergency medical services in the case of a suspected drug poisoning. This means individuals won't get in trouble for having small amounts of drugs or drug paraphernalia on them while trying to help or get help. Overall, naloxone/Narcan saves lives. There are laws in place to protect you and others when using Narcan. There are community resources who are happy to provide free supplies of Narcan and training on how to use it. Narcan can be used on anyone experiencing an opioid drug poisoning. And as we discussed, opioid drug poisoning is possible for those who might get substances laced with fentanyl. Folks who access these substances may or may not have a substance use disorder, and it is not restricted to those who use opioids. Please check out the community resources provided below to receive free Narcan and Narcan training.